There are a lot of features that separates us, the human beings, from those of lower animals. One such important feature is our face. Face gives us the identity as well as the ability to express emotions. We can express various emotions through actions of our muscles of the face. These are some of those emotions. It's hard to believe that these emotions are in fact the secondary actions of the muscles of the face and their primary action is something else. They basically act as either sphincters or dilators that are present around the openings of our face. And in this session, we will learn more about the anatomy of these facial muscles. The learning objectives for this session are, at the end of completing this session, you should be able to define what is face and what is its extent. Define the peculiarities of skin and fascia of the face. Describe the peculiarities of the muscles of face. List the muscles of face. Describe their attachments, innervation, and actions. And we will focus on three important muscles, not all the muscles: orbicularis oculi, oris, and buccinator. Let's begin with understanding what exactly is face and what is its extent. Face refers to the anterior aspect of the head. That is the simplest definition of face. It is the anterior aspect of head. What is important is to understand from where to where the face extends. Above, the face extends from the anterior hairline. This is an interesting boundary. We are taking the anterior hairline as the upper limit. The lower limit is the chin and the base of the mandible or the lower border of the mandible, right? Whereas on the sides it is the front of the ear. This is the extent of face above, below and on the sides, right? Now remember, when we discussed scalp, we said the scalp begins from the supraorbital margins. So the forehead actually forms part of both scalp as well as the face. That part is common to both scalp and face. This is regarding the extent. What is the relationship between the head length and the total body length? There is an interesting correlation between the entire head length and the length of the entire body. In case of an infant is a newborn within the first year of age. In case of an infant, the ratio of head to the entire body length is about 1:4. Whereas this in adults will increase to 1:7. So the head height gradually decreases as we grow. This is one important relationship between the head length and the body length that we should be aware of. The skin and the fascia of the face show some peculiarity. Let's try to understand what are these peculiarities. The skin of the face is highly vascular. So what? This is the reason why the facial injuries bleed profusely similar to the scalp. But the advantage is because of this high vascularity, the injuries of the face heal very quickly and the plastic surgeries of the face yield very good results because of improved healing. The skin of the face is rich in sebaceous glands and sweat glands. What is the importance of this? This will result in increased occurrence of acne over the face, and also face is also a common site for occurrence of sebaceous cyst, similar to scalp, remember. Then the skin of the scalp is thick. Now please remember this. When we talk about the histological type of skin, the skin over the face is thin skin or hairy skin. But we are using the term the skin appears thick. This is because all the muscles of the face have subcutaneous attachment, subcutaneous insertion. That is why this skin of the face appears or feels thicker. Then the skin below the face or the layers below the face is lax. Why? This is because of presence of loose areolar tissue which is filled with fat. and this fat becomes abundant in certain regions, especially the region over cheeks. Have you heard of buccal pad of fat, which is seen in infants? This is the fat accumulated within the superficial layer. And because of the laxity of the skin, the fluid can get easily accumulated within the skin of the face. In renal failure or in chronic kidney conditions, we usually see facial puffiness, facial edema. Why is that? Because the fluid can easily get collected beneath the subcutaneous tissue of the skin. Then, skin is an area where you don't find deep fascia. The deep fascia is characteristically absent. Is it applicable to all over the face? No. There is something referred to as parotid fascia, the deep fascia covering the parotid gland. Okay? Now, this fascia is an exception where you have deep fascia in the face. Apart from this, there is no other part in the face where you get deep fascia. Similar to this, there is one area in the face where you don't find fat. Can you tell me which region it is? Yes, this is the eyelid. So, eyelids are a special type of area of skin where you don't get subcutaneous accumulation of fat. There is one more important region, the scrotum, which covers the testes. These are the areas where you don't get subcutaneous fat. This is regarding the peculiarities of skin and fascia of the face. Similar to the skin and fascia, even the facial muscles have peculiarities. Let's learn what are these. All facial muscles are subcutaneous and they are remnants of a subcutaneous sheet of muscle referred to as peniculus cornosus. Now, what is this peniculus cornosus? This is a subcutaneous sheet of muscle present in lower animals which allows the entire skin to slide over. In human beings, there are only some part of the body where this persists, and facial muscles are actually a remnants of this peniculus cornosus, and hence all these facial muscles are subcutaneous, present immediately beneath the skin. Morphologically, again, as I said, these are remnants of the peniculus cornosus. That is why they are subcutaneous. Embryologically, all muscles of the face, they are derived from second pharyngeal arch or second branchial arch. This is the reason why they are supplied by facial nerve, as we will learn later. Now, what about functional arrangement? All facial muscles are arranged either as sphincters or dilators around the orifices present in the face. For example, the orbit, the nostrils, and the oral cavity. And as I said earlier, the facial expressions are secondary effects of these sphincteric or dilator action of the muscles of face. Then, muscles of the face are peculiar in that they have something referred to as small motor units. Now, let's try to understand what are small motor units. Imagine you have a muscle fiber and you have a single nerve supplying it. This is what we refer to as small motor unit. If you have a muscle fiber, then it has multiple nerves innervating it. This is referred to as large motor units. Now, why you need to have muscles with small motor unit or large motor units? If a single muscle fiber is having a single nerve controlling it, the precision of this muscle fiber will be much more compared to the muscle fiber which is being innervated by multiple nerves, right? So, the muscles of the face have small motor unit because they need to produce precise movements which are essential for producing the facial expression. That is why the muscles of face have small motor units. Can you give me any example for other muscles in the body with small motor units? Very good. One is the muscles of the thumb or the intrinsic muscles of the hand. All these muscles have precision movements. Apart from this, we can think of laryngeal muscles. Laryngeal muscles, they are involved in production of voice, right? So laryngeal muscles and muscles of hand, these are other muscles in the body which have small motor units. Right? This is regarding the peculiarities of the muscles of the face. Can we just recall whatever we have learned till now? I said the muscles of the face are morphologically peculiar. Why? Because they are derivative of a subcutaneous sheet of muscle called as peniculus cornosus. Where do you find peniculus cornosus? It is seen as a single sheet of muscle in lower animals. In human beings, persists only in some of the regions, especially face, the other region being scrotum, where we have the dartos muscle. Embryologically, we said the facial muscles are important because of what reason? All of them are derived from second pharyngeal arch and hence they are supplied by, so they are derivatives of second pharyngeal arch and hence they are supplied by the seventh cranial nerve or the facial nerve. Right? And functionally, facial muscles are arranged as either sphincters or dilators and they have what we refer to as small motor units. We learned what are small motor units? Single muscle fiber innervated by a single nerve fiber. What are the other locations where you find muscles with small motor unit? Muscles of the hand and muscles of the larynx. Let's continue further and discuss about these muscles of face. This is an image which shows the frontal view of the face and we can see plenty of muscles. Now the question is, do we need to remember and learn all of these muscles? The answer is no. We will focus on the details of three most important muscles of the face, but let's try to identify some of these important muscles. We have identified this muscle already. This is the occipitofrontalis, which forms also the muscle of the scalp. Then this is the orbicularis oculi, which is present around the orbit. Then this is the nasalis. Of course, there are different parts of it, but just remember, this is the nasalis. So we have muscles arranged around the eyeball or the orbit. We have muscles arranged around the nose, and then we have muscles arranged around the oral cavity. Okay. Now this is our orbicularis oculi, orbicularis oris. Right. Then we have the zygomaticus major. Then we have the zygomaticus minor. These are the levator muscles of the upper lip. Then this is the depressor anguli oris, whereas this muscle is risorius. As I said, there are plenty of muscles. Let's not worry about each of them. We will focus our discussion on three important muscles, that is orbicularis oculi, then orbicularis oris, and one more muscle which is present in this region which is referred to as buccinator. Let's begin the discussion with the details of or the anatomy of orbicularis oculi. We will learn the muscle under these headings. What are the location, parts, attachments, the nerve supply and actions. Where exactly the orbicularis oculi is present? The orbicularis oculi is present around the orbit, as the name suggests. It has three parts. The first part is known as the orbital part. The second part is known as the palpebral part. And the third part is known as the lacrimal part. Right? These have different attachments. Let's try to learn them. The medial part of your eye has a ligament called as medial palpebral ligament. The orbital part arises from this, sweeps over the entire orbit and gets inserted to a structure here called as lateral palpebral raphe. So this is the medial palpebral ligament I said, and here we have something referred to as lateral palpebral raphe. Fine. This is regarding the origin and insertion of the orbital part. The palpebral part, as it suggests, it is present in the eyelids. Again, this arises from the medial palpebral ligament, then sweeps over the eyelids. Right? Again, ultimately it gets inserted to this lateral palpebral raphe. The third part is a small part of the orbicularis oculi which arises from, let's imagine we have a sac here called as lacrimal sac. It arises from the lacrimal bone covering the sac. Okay? Again, it gets inserted into the skin of the eyelid. This is regarding the attachments of the orbicularis oculi. What about the innervation? In single sentence, you can remember like this: all facial muscles are supplied by the seventh cranial nerve. Which is the seventh cranial nerve? It is the facial nerve. And one more thing is, whenever you mention cranial nerve, always use Roman numericals. Right? What about the actions? Orbicularis oculi brings about many actions. One important action is it helps in forceful closure of eyes. Like this, especially when you are exposed to intense light. So orbicularis oculi protects from intense light by closing the eyelids. Forceful closure of eyelids. Then it assists in blinking. The gentle closure of eyelid, as in during sleep or during blinking, is also brought about by orbicularis oculi, but it is by the palpebral part. The orbital part, whereas, is concerned with more forceful closure. Then, the third important action is the drainage of tears. Okay, drainage of tears. You can ask how? We said there is one part that comes from the lacrimal bone covering the lacrimal sac. Contraction of this part will help in drainage of tears. The fourth one is not an action of orbicularis oculi, but you can see it as a reaction of aging process. Usually in old age individual, you will see wrinkles coming from the lateral part of the eyelids. Okay? Now this is referred to as crow's feet. Now what is this crow's feet? This is due to contraction of the orbital part of orbicularis oculi, which is seen especially in old age individuals. It is not exactly an action, but you can remember this as one of the effects which you can see with aging. Right? So this is regarding the details of orbicularis oculi. Very frequently asked in your theory exams. Then, the next important muscle that we want to learn is orbicularis oris. Again, I want you to remember these headings and always write about any muscle under these headings. So where exactly orbicularis oris is located? As the name suggests, this is present around the oral fissure or the oral cavity. That is regarding location. What about the parts? When we come to the parts of orbicularis oris, different authors describe it differently. But what we will use is, we will use the term as the deep fibers and we will use the term superficial fibers. As I said, some of the authors even use pars marginalis and pars superficialis for these terms. Fine. Some authors also use intrinsic part as well as extrinsic part, which are almost the synonyms. But again, I'll repeat, we will use the term deep fibers and we will use the term superficial fibers. What about the attachment of these fibers? Let's begin with the deep fibers. Close to the angle of the mouth. Fine. Now, what do we mean by angle of the mouth? These are the areas where the upper lip and the lower lip meet, right? So, you have a fibromuscular node called as modiolus. Right? The deep fibers take its origin from modiolus and pass over to the oral fissure. This is the arrangement of the deep fibers. Then what about the superficial fibers? Okay? Now superficial fibers are arranged in two sublayers, upper layer and lower layer. Okay? So we'll call this as the upper bundle and lower bundle. What exactly are these? Now, upper bundle arises from a muscle called as, we have a muscle called as levator anguli oris, and then we have a muscle called as depressor anguli oris. Okay? So, fibers come from these muscles. Okay? So, this is about the superficial fibers, the lower bundle and the upper bundle. The insertion of these muscles is into the dermis of the skin. That's all you need to remember. Okay? Deep fibers, superficial fibers, upper bundle and lower bundle. Right? Then, innervation, as I said in the previous slide, the innervation of all facial muscles is by the 7th cranial nerve or the facial nerve. What about the actions? What was the action of the orbicularis oculi? It was closure of the eyelids. So what will be the action of orbicularis oris? It will be closure of the mouth. Fine. So in one single word, you can remember this action. So this is regarding the details of orbicularis oris. The third most important muscle that we need to learn is buccinator. Okay? Again, we will use the same headings. Where is the buccinator located? Buccinator is a muscle of the cheek. It is present around the cheek region. Right? What about the origin of buccinator? Buccinator has triple origin. Let's try to mark this origin. The buccinator arises from the upper fibers, the outer margin of the maxilla and mandible opposite to the third molar tooth. That is the first origin. Then what about the third origin? The third origin arises from the pterygomandibular raphe and maxillary tuberosity. Right? What about the second then? This arises from a raphe called as pterygomandibular raphe. So this is the three-layered origin of buccinator. Above from the outer surface of the maxilla and mandible, below by a ligament connecting the pterygomandibular raphe and maxillary tuberosity, and then the middle fibers come from the pterygomandibular raphe itself. What about the insertion of this muscle? The fibers coming from this upper origin pass to the upper lip. Right? Whereas the fibers coming from the lower origin again pass towards the lower lip. But the fibers of the pterygomandibular raphe are peculiar because the fibers intermingle. The fibers from the upper half of the pterygomandibular raphe will go to the lower lip, whereas from the lower half of the pterygomandibular raphe will go to the upper lip. Right? Again, the insertion is into the dermis. So this is regarding the characteristic arrangement of the buccinator muscle. Right? Innervation supplied by or innervated by the 7th cranial nerve or facial nerve. What about the actions? Actions of buccinator muscle is, it is also known as trumpeter's muscle. Why it is called as trumpeter's muscle? It allows for accumulation of air between your cheek and the oral cavity, which is essential for blowing of wind instruments like trumpet. Okay, so that is why it is referred to as trumpeter's muscle. It helps in blowing of air into anything. Okay, that is the chief action of buccinator muscle. The second important action of buccinator muscle is, it prevents the accumulation of food in the vestibule of the mouth, that is between the cheek and the gums or the teeth. Fine, it prevents the accumulation. It helps in clearing of the accumulated food. If you remember the session on muscles of mastication, we also said that this acts as an accessory muscle of mastication. Right? So these are the important actions of buccinator muscle. Then, One of the commonly asked questions in your theory exam or your practical viva is, what are the structures that pierce buccinator muscle? You need to remember buccal branch of mandibular nerve. This is the most important structure that pierces the buccinator muscle. Then remember about parotid duct. The two important structures, a duct and a nerve, and then it also allows for piercing of mucus glands. Okay, as I said, commonly asked, short answer and viva question during your exam. Parotid duct, buccal branch of mandibular nerve, and mucus glands, the ducts of the mucus glands pierce the buccinator muscle. This is regarding the details of the buccinator muscle. As I said, there are plenty of muscles in the facial region, but we cannot remember the attachment of each muscle, and we cannot even remember the actions of each of these muscles. We learnt about the actions of three important muscles: orbicularis oculi, which closes the eyes; orbicularis oris, which closes the mouth; buccinator, which helps in blowing of air and also assists in mastication. Now, some of these important expressions of the face is brought about by some important muscles. For example, let's say this is the action of frowning, where you have these vertical wrinkles over the medial part of the eyelids. This is brought about by a muscle called as corrugator supercilii. Fine. Now then, let's imagine this is the expression of anger, which is characterized by dilatation of nostrils. This is by dilator nares, which is a part of the nasalis muscle. Then we can see that this is the action of smiling or laughing. This is brought about by the zygomaticus major muscle. Fine. So these are some of the actions you may want to remember. Apart from this, we have learned the transverse wrinkles over the forehead is brought about by which muscle? This is by the occipitofrontalis. Done? So try to remember at least few important expressions like this and what are the muscles bringing about these important expressions. But what I want you to remember is this is again the secondary action of facial muscles. Fine? Right. Let's summarize then. We learned face as part of the head, the anterior aspect of the head, extends from the anterior hairline above to the chin below and to the sides, the ears. The skin of the face is peculiar in being highly vascular, lax, thick, and allows for easy accumulation of fluid. The deep fascia is absent in the entire face except for the parotid region where it forms parotid fascia. There are plenty of muscles of the face which are present in the anterior aspect. All of these need not be remembered. We learnt about the details of orbicularis oculi, which closes the eyelids, orbicularis oris, which closes the mouth, and then the muscle of the cheek or the buccinator, which is involved in blowing of air, and also important muscle of mastication. We learnt about peculiarities of facial muscles. All of them are subcutaneous. Morphologically, they are remnants of paniculus carnosus. Embryologically, they are derived from second pharyngeal arch. And functionally, they are arranged as sphincters or dilators around the orifices of the face. Regarding their nerve supply, we learned that they are supplied by the seventh cranial nerve or facial nerve. What is the embryological basis? The facial muscles are derived from second pharyngeal arch, and facial nerve or the seventh cranial nerve is the nerve of the second pharyngeal arch. This is what I want you to remember in the topic of the muscles of face. That's it for this session.